Thank you for joining.
Hello, thank
Hi.
you.
Thank you. I'm still waiting for, we have about 35 people who registered, as I was just mentioning to the other attendee here. Sometimes people show up, people sometimes will just register and then watch this at a later date. So that's the beauty of being in the virtual space, that if people have last minute conflicts or can't show up and they just want to know the information, that at least it's being recorded. So I actually am going to start only because a couple of things. First of all, I am very under the weather right now, and I didn't want to cancel because this has been such a long time coming and I put so much effort into this, and I just don't have other Wednesdays to reschedule to. So that's one thing. I feel like I'm already talking about half speed that I normally do. And number two, this is a very ambitious webinar. So there's a lot of information to be presented, almost to the point where I feel like I'm going to run over. So I just want to allow everybody who is attending to know that if they do have to leave, this is all being recorded. You can also share with me in the chat box any questions that I can capture as the time passes, just in case this is running over time. So usually these are about an hour, but sometimes they go to about an hour and 15, hour, 20 minutes or so. I'm going to do my best to make sure I stick as close as possible within that timeline. So in our recorded sessions, or in these wellness webinars that we do, I always like to share some housekeeping items. Obviously, as you probably heard, as you were entering into the webinar, the little announcement saying that this is going to be recorded. And I do that exactly for this reason. So if in case anybody can't make it, they can watch it at a later date. And I also have it at some point in the future. I end up uploading these to my YouTube channel, and I have that as content that lives kind of, forever, evergreen, if anyone else wants access to it who didn't get a chance to register at the time. You are automatically brought in here with your microphones and your cameras turned off, but you can unmute yourself or turn your camera on at any time if you want to share any information. So, I try to have this as an interactive discussion, but of course, just to keep things as manageable as possible, if you don't mind putting things in the chat instead, and then at some points during the natural progression of the presentation, I'll stop and I'll look and I'll see if we can, if I can engage in Q&A at that point. And then we also always have an end of, excuse me, thank you, Leonie, me too, thank you. We always have an end of presentation Q&A, open Q&A, and so, but you can always put stuff in the chat box. I also like to disclaim that anything that I'm sharing with you today, even though I am a registered dietitian, I am not your registered dietitian. I don't know any of your history, so please don't take any of this information as medical advice. We always encourage you to be sure you are speaking with your primary care physician, other specialists, and healthcare providers before you begin any regimen or take anything into account. So make sure you get that clearance from your doctors. And then as part of our programs that we've been doing for the last 4 years, we like building upon what it is that we are doing, finding out if there's anything that we can do better. So at the end of this presentation, probably within the next day or so, you'll get a copy link of this recording. You're automatically included on our email list, so you might get future follow-up emails. You can always opt out of them. And we usually like to send a survey just to say, how did it go? Is there anything else you're looking or are interested in as far as topics are concerned that we can fold into future topics and future conversations? In just a lot of the times when we're working on some of this information, health sciences and food, nutrition, physical activity, I always like to just present with a trigger or content warning that there is going to be conversations or discussions included in here about weight, mental health, eating disorders. So if in case that is something that triggers you or that you are sensitive to, please feel free to opt out or, turn off whatever you need to turn off and walk away as we're working through this. Language used in here too, we defined male and female as, I guess, what we consider like the conventional definitions, people who are assigned male and female at birth, who live conventionally as men and women, because right now in our textbooks and our resources, there's not a lot of language that accommodates other transgendered people or gender fluidity. So I apologize in advance again if this doesn't feel very inclusive and sometimes, but I'm basing it off of whatever we have available, and I don't want to make any errors in my language, so just keeping that on. And then, as I said too, for those of you who are joining, we have about 35 people who registered. Obviously, sometimes people do or don't show up to the live webinar, but this is being recorded. I have a large variety of information to share with you because I'm basically taking you all the way from birth to death in this discussion. So we might run a little bit long. I'll do my best to keep on track, but It's a hefty amount that I want to share with you. So if you do have to peace out, just know it's being recorded and you can always watch at a later date. So let me formally introduce myself to those of you who might not know me. My name is Dina D'Alessandro. I have been a registered dietitian nutritionist for almost 6 years now. Actually, I'll be celebrating my 6th year at the end of this month. And I'm based out of New York City. I also work sometimes out of Ocean County in New Jersey. And I also work a lot on the virtual space. I've worked with various populations, from high risk prenatal populations, patients, and even college students, because as I'll share with you here, I am also related to CUNY Lehman College. I'm an adjunct lecturer there. So if you are familiar with City University in New York, you know that we have a variety of campuses. I am at Lehman College in the Bronx. I'm also, for this particular webinar, collaborating with a group that I'm affiliated with, specifically at Lehman. So sometimes I just do this on my own as Dish with Dina, but today I actually have a collaboration going with them as a kickoff to some other webinars that we'll be doing with one of the programs on campus. And lastly, I'm also a CDC trained diabetes prevention coach. So I work with people who are at risk for diabetes or who have been possibly diagnosed with pre-diabetes to help them manage or prevent that from progressing. In my previous life, I worked in meeting and event planning, which is why I love doing things like this. This, I really think, helped hone a lot of my organizational skills and has come in handy when I'm working with my patients and clients, because I really see that unique way to help support them and guide them in developing a realistic and sustainable way to be successful in their healthful habits, achieving their healthful wellness goals. I'm also a preceptor or a supervisor to nutrition students, volunteers, and dietetic interns. So people who are coming up the ranks who will eventually be dietitians on their own at some point. And one of the things that I've posted here at the very bottom of the slide, this is, for those of you who know me, I take a lot of things on. I don't mean to. I feel very fortunate that a lot of opportunities come my way. And if they are in alignment, as this one was for this semester, I say yes to them. So I'm actually very happy to announce that I've taken on a new position overseeing a new program at Lehman College, which is called Lehman CUNY Cares. And we are working on an extension of the services that are already they're existing in our campus. So this is a grant funded program that allows us to help students expanding food security work, developing new approaches to increase food security with Lehman's Office of Campus Life and the food bank. We're also providing SNAP outreach, so that's the Supplemental Nutrition and Assistance Program outreach, and enrollment assistance to students, and increasing health education in relation to nutrition and healthy eating. So I'm actually now officially, after a 2.5-year hiatus, also going back to the Lehman campus as their campus dietitian. So please forgive me if a lot of what I'm talking about today feels very focused on some of the student population, but I do know that's where a lot of my the attendees reside, and they are purposely being driven to this webinar to watch this, or to at least watch the recording when we're done. And so if you are an affiliated Lehman College person at the end of this presentation, or to learn more, I'm going to put a link in here, and I'll also share on screen at some point a flyer where you can scan the QR code, and this way you can sign up to learn more about the programs that we're developing, the services that we provide on campus. So again, this one I'm putting in the chat for right now is just for currently enrolled Lehman College students. So even though there's just a handful of you on here, which is okay, let me learn a little bit more about you. I always like to see where you're coming from. So where in the world are you physically located and watching this webinar from? So if you don't mind putting in the chat your city, state, or country. As I said, I work out of New York, New Jersey, and the virtual space. I'm currently in Manhattan in the East Village, and I am working out of my apartment here, which is what I tend to do for the majority of time. Boston in the house. Hey, Stanley, I think I owe you, as I probably always do, a reply to one of your last messages. So thank you for your patience. And since our topic is focused on life cycle and the stages of life, I thought it would also be kind of cool to understand a little bit about how young is the youngest person in your household? How old is the oldest person in your household? So I mean, literally, who do you live with that's the youngest and the oldest? So as you are typing in there, if you don't mind sharing that, I'll share with you. For me, my boyfriend and I are the only ones in our apartment, aside from our 8-year-old cat, and we are both in our 50s. I also mentioned before that I spend time working out of Ocean County, New Jersey. That's because that's where my mom lives. And while she is spunky and independent. Sometimes she needs some assistance from me, and she's going to yell at me for divulging that she's in her 80s, but she looks great for her age. And I'm so glad that she's still around for me to be able to hang out with and take care of. Let's see. Oh, okay. Oh, Lehman of the Bronx. Thank you, Elizabeth. Thank you. Oh, so 27 to 29. Okay, so that's a very specific life cycle stage. So not a huge span in there. I know a lot of my students have babies and then older folks living in the same home. So there's quite a diverse population going on, even in those smaller environments. So let's start first. This is something that I've tried to include in a lot of my discussions as of the last couple of years of just defining health, what it even means when you say what is healthy or what does it mean to be healthy. And I think if you feel like sharing your definition in the chat, I feel like this is one of those things that people tend to define with like just a different word, but it's the same thing. So they'll say, it means that you're in a state of well-being. Okay, well, what does that mean? Or what's the extreme versions of that? What's not well enough or too unwell? Like, where do we draw the line there? And so as you might be providing insight in the chat there as far as your definition of health, I'll share what the World Health Organization says. And this is a state of, again, listen to the words, right? A complete, whatever that means, complete physical, mental, and social well-being, and not merely, though, the absence of disease and infirmity, right? Or so being sick. So that's really something to take into account too, because if we focus too much on this extreme version of ultimate health, of how we're going to be completely devoid of anything going wrong with us, we're in perfect condition, this is what ends up becoming what we've known to be this new term of healthism, which focuses on or places the responsibility on a person and makes it more like a moral obligation for them to maintain good health. But we know that that can be negative as far as consequences leading to issues like eating disorders and negative body images. It also doesn't take into account a lot of other factors, external factors like health inequities and food access. And it also ends up denying people who might be dealing with chronic conditions, autoimmune diseases, mobility issues, amputations. Like, just because you're dealing with something in your life that is considered a disease or a condition might not necessarily still mean that you're not well. So let's take a look at this next slide just to understand a little bit about what roles other things play and how we manage and engage in factors that are supposed to support our health. So I think it's a very privileged position for us to even be able to address control over a lot of these things and set goals for ourselves when there are so many disparities in the healthcare system. And so obviously for our webinar purposes, we want you to feel comfortable with whatever makes sense for you, whatever you're taking away from here, understanding that, again, there's nuances to this. And we want to also empower those of us who are more privileged to try to advocate for anyone who might come across as marginalized in your community, state, country, anywhere in your circles. We want to raise awareness. We want to try to understand what are known as the social determinants of health and help us educate ourselves and others in our personal and professional lives, especially if we are involved in the health sciences, where training should come with whatever work environment so that you understand a little bit more the role that you play with disadvantaged communities. And that would also include reducing our implicit bias and helping us develop something called cultural humility, where we have that sensitivity approach of understanding that not everything is a one-size-fits-all, Eurocentric type of treatment plan or intervention. So if you are currently experiencing inequity of any kind, I really want you to feel comfortable and reaching out. Let us know how I can support you, or how I can maybe provide you with some resources. So one of the services that I mentioned before with this new Lehman College program that I'm working on is related to food security. So that means that we're trying to expand access to not just enough food, but also safe food, nutritious food. And this is really a growing concern for people who do have a variety of different life cycles in their household, because if the child is going to be food insecure, that's going to potentially hinder their growth and development, or the parent or caregiver might forego their nutritional needs in place of providing their child with something nutritious. So a lot of factors come into place. And of course, we can go on and on with a lot of these discussions, but for our purposes here, I just wanted to at least share that with you as an underlying kind of awareness factor. So let's begin with infancy. I'm going to share a general overview from this point forward, and I will include some possibly new information and research updates that you may or may not be aware of. And then I'll focus a little bit more too on the adult and older adult life cycle as we go through. So you might see a lot of information on some of these slides and not a lot of information on others. So when it comes to infants, this is what in the first year of life, like from 0 to 12 months, this is what is known as the most rapid growth that we're going to see. It really differentiates this life cycle from any other age. We are looking at adequate nutrition for normal brain development. We're also taking into account biological and environmental factors that interact during infant growth and development. And so when we come to assess a child at this stage, we're going to be looking at things like growth charts, head circumference, gestational age in comparison to perhaps percentiles of other children in that particular area. Again, assuming that we're looking at typical healthy children. Obviously, if there are children with special conditions, they might have their own ways of assessing. But this is to keep us on track, making sure that we're watching for things like continued decline or rapid increase in things like weight and height or stature, head circumference, etc. So you can see the rate of progression here where you'll have that the infant triples their birth weight within that 1 year. I mean, it's kind of hard pressed to try and make that happen at any other time in your life. So these are things that you just want to keep an eye out for. Make sure you're going to your wellness visits and getting supported in that way. Now I'm going to share with you a little bit about human milk and cow's milk, this discussion here as well, or what we know as breastfeeding or sometimes formula feeding. The recommendation that we've come to see through the research that's been done, not only through the dietary guidelines for Americans, but also with the American Pediatric Association, is that yes, exclusive breastfeeding for at least the first 6 months, if not into the first full year, is what's recommended because it does help build immunity. It does provide some individualized ratio of the macro and micronutrient needs that a baby needs. But I also want to make sure that I support anyone out there who is not ready to breastfeed, wants to breastfeed, can breastfeed for certain issues. So really the phrase that used to be thrown around of breast is best has now been kind of turned around into fed is best. Like we just want to make sure that your child is getting enough of what they need. And we also want to take into consideration, again, these possible issues with anybody who might not be able to or doesn't want to breastfeed, which is totally their choice. We also want to take into account cross-cultural considerations, different kinds of practices and values that do influence on the decision of duration of breastfeeding, how and what to feed, and also the fact that some of the formulas that are commercially available as far as baby foods are concerned really reflect the dominant American culture rather than take into account that ethnic diversity. So these are things, again, if you're working in the healthcare setting or if you are a patient who is going on these wellness visits, I want to really help encourage and support and empower you to be able to engage in that discussion of, hey, what about these things? And can I get access to this thing instead? Or can you provide me with resources that are more applicable to my home setting, my culture? We also have what's called a lactation consultant. So that's a healthcare professional who specializes in helping people with breastfeeding. And they have an international board where they take a test and they have to get credentialed in that way. If you live in New York City, I'm actually going to put in the chat where you can find a lactation consultant. And even though the chat message doesn't stay on during the recording, it does fold into a text document. So I'll add this in for anyone who is coming in late or is not going to watch this until later. If you are elsewhere in the States, here's the AmericanPregnancy.org link so you can find what you need as far as lactation consultants, if that's something that you're interested in. Just a little bit about cow's milk. So this is something too that we want to be conscientious of, especially in that first year of life. We really don't recommend that whole or even reduced fat or skim versions of cow milk. Cow's milk is being used during infancy because it just does not match up with what their needs are. And also because at this stage, their gut is not yet completely developed where they can process that. So there's another thing that comes into play here too, just for the mere fact of the calcium components in cow's milk that it can actually counteract with iron. So you might end up getting an iron deficiency anemic child in this stage if you are feeding the baby cow's milk, because that calcium mineral interacts with iron. So low iron availability might end up resulting from gastrointestinal blood issues or lack of other iron-rich foods during this time if you're feeding your child cow's milk. One of the hot topics that comes up a lot is food allergies. If you've had a child or if you've been a child in any of the elementary school systems across the states, you might have come to learn about peanut-free classrooms or things that you're taking into consideration when you're going to birthday parties. But really, when we look at the data, only about 6 to 8% of children under 4 years of age actually have been diagnosed with true allergies. And when you talk about allergies, the way that we define this is the absorption of intact proteins as the basis. So you're going to have an autoimmune response of proteins within a food. So the guidelines here are recommending either breast milk or a specific formula for in case there is an allergenic cause. But more importantly, I want to walk you through some of the top allergens and teach you a little bit more about early introduction, which is really what we're trying to go through. So the top 8 food allergens here, I say this to my students all the time. I can't memorize this. It doesn't lend itself well to a mnemonic device. But what I try to do is do like a little fake shopping trip through the grocery aisles. And so you can see on screen here, you have wheat, which technically is the gluten in the wheat, the protein, intact protein in the wheat. You have milk, animal milk, you have soybeans, you have both peanuts and tree nuts, and you also have shellfish and fish. And then as of 2021, we actually brought in a 9th major allergen, which is the seed known as sesame. So the seeds here are now part of the top 9. So the reason why I say this is because food packaging will disclaim what is on there. And it's also important to know if you do have an allergy that you might be allergic to one thing, but not the other. So it doesn't necessarily mean that everything applies and you have to be afraid to stay away from all of the things. And so we really encourage this introduction of complementary foods when you start seeing the infant being ready to receive this, which is about at age say between 4 to 6 months, usually around more like 6 months, where you're going to offer the food in small teaspoons and provide them semi-soft foods once or twice a day and have them get a little bit more familiar with anything that is not breast milk or formula. So things like mushed up rice, cereal, water, complementary foods can really end up being just a softer version of whatever it is that you're eating at home. So if you are working with cultural traditional foods, and by all means keep that in mind, obviously just make sure that they're not full of like our onion, garlic, or anything spicy. Make sure that it's appropriate for the infants in both texture and flavor. So in here, as you can see on the bottom with the non-choking foods and also introducing the peanut and other allergens in there, what we've come to see there was something called the Learning Early About Peanut Studies. This is a giant research study that was done a while back. In the case of the last 20 years or so, we found that it's mostly expert quote unquote opinion that said, hey, you should stay away from some of these allergens. But really what we've come to learn through these research studies is that introduction of these allergens, these allergenic foods earlier around the 4 to 11th month mark really ends up significantly reduces or decreasing the risk of even developing those allergies to begin with. So obviously, you want to make sure you're not doing this in a place that feels unsafe. So have very small amounts that you're providing your child, and you might even want to bring these allergens with you in small forms to your wellness visits. This way, in case your baby does have some sort of reaction, your doctor's there with baby Benadryl or something that can end up taking care of that situation from getting worse. I also like sharing some things about programs that exist, so I'm going to put this in the chat as well. So this is something called Early Head Start program, where it provides family support, especially to low income families, and more specifically to infants and toddlers during this time of their life. And then last here, about screening. So just like as we're aging, right, we're being told go to the doctor. So this is something too, just to keep in mind, that we have blood tests to check for rare but serious health conditions. This is usually done at a healthcare setting or in the hospital about 5 to 7 days of after birth of your child being born to see if there's any rare conditions that possibly could be happening. There's a hearing screening that can be done, and there is also the heart screening that can be done through what's called a pulse oximeter machine, just to make sure that the heart is working properly. So all of those things should be part of your wellness visits, or when you have the baby and you're coming out of the hospital, these are the things that you should be looking for and making sure that are done, and what you are having access to, hopefully. We enter into toddler and preschoolers. So now we're talking about that sweet little age, depending on who you are, if this is sweet or not so sweet, between the ages of 1 to 5 years old, where you now start seeing a rapid increase in gross and fine motor skills. Kids are starting to get more autonomous, right? They start having broader understanding of what's going on around them. They start learning language differently, and they start having things like expanding behavior control. So they're told, hey, be mindful of this, don't hit your sister. All of these things start coming up in this stage of life. And so here you'll also might find some feeding behaviors related to strong preferences. No, right? Throwing things on the floor. They might have what are called food jags, where they're only going to be eating the same thing over and over again. And so we really encourage trying to serve new foods with familiar foods. It does take a very long time to get children to like something. So try not to be too exasperated if you feel like you're going over and over again of trying to get your child to eat the same thing. It takes about 10 to 20 times depending on the child. So mix things up, do things in different versions. Maybe if you feel like quote unquote hiding something in a little milkshake, or in their whatever vegetables, mashed potatoes, you want to add some spinach in there too, fine. Or you can just do different versions of cooking methods if you want to. And of course, this is where we also say they're going to be imitating your behaviors too. So whoever is in that particular environment, this is where now you can model behaviors too. At this age, this is the best part of being this age too, I think, is that you have an innate ability to control your energy intake, which means you know how many calories you need. And when you're done, you're done. You're either going to push the plate away, I don't want any more, or you're going to come around and say you're hungry. It's only when we get older that we start hearing other influences and external factors of that's enough for you, stop eating this, don't eat too much, or you're not eating enough, that really starts affecting our relationship with food. So just out of curiosity, you can put in the chat if you want to, have any of you been part of what I call the clean plate club? I know for me, growing up with my Italian parents, immigrant parents who were very particular about how much we, wasted with food, they would kind of force feed us a lot of things, even though we were tiny children and we didn't have big stomachs, and then get mad at us for not eating because, of course, there were children starving all over the country, and I was personally responsible for that. So the Clean Plate Club is something I try to encourage people to avoid telling their children. It's not the responsibility of them to finish everything. It's just their responsibility to know when to eat and what they're going to eat. So I'll share a little bit more about that in the coming slide. And we'll also talk a little bit more about this too, about actions and languages that might affect a child's relationship with food in the adolescent section. Yep, there you go, Leonie. Thank you. Lifelong members, right? So I'm putting this in the chat also. This is Ellen Satter. She's a registered dietitian, and not everything is absolutely perfect in my recommendations, but I really do enjoy looking at her resources when it comes to what's called the division of responsibility. I think it's a great guideline for understanding the role that both children and parents or care providers give when it comes to their relationships with food. So we have parents who provide the what, the where, and the when, some structure. And obviously, this is what we're having ham sandwiches tonight, or we're doing a pasta dish, or I'm going to have meatloaf, or whatever this is, the what is going to be there. And then the children, hopefully in a good environment, are able then to decide that innate ability of the whether they want to eat and how much. So this is where I can understand people getting frustrated. My kid doesn't eat, he's a picky eater. I really encourage you to take a look at some of these resources, and maybe even work with a pediatrician and a pediatric dietitian who does focus on picky eating to help everybody feel a little bit more comfortable. And just hang in there. Your child probably will not end up starving to death if they don't go 24 hours without food. So please don't end up resorting to giving them a bowl of ice cream just to shut them up because they can't stop crying and they don't want the meatloaf that you provided. Allow them to just sit and be there with the food in front of them so that they can decide whether and how much. Next up, some of the challenges that also happen during this time of life, believe it or not, right? Because the kids are sitting in front of screens and watching TV, or maybe they're in daycare and they have a lot of interaction. But we start seeing food industry advertising targeting children. We also see other industries that objectify specifically girls. And now we start seeing body dissatisfaction happening, eating disorders, low self-esteem, weight bias and stigma starts coming up, marginalizing children, perhaps even teasing and bullying happens at this age. And now this really is where the rest of the decades of life start picking up where this leaves off, because this can, whatever this relationship happens here at this stage of life, can really affect the rest of your growth. Hopefully, if you make it that far. A lot of people end up going into depression. We also see some suicidal thoughts happening. Yes, even within this age range, even as young as 3 years old, we found that research shows children can become aware of different body types and labels that are used, like I'm too fat, I'm too skinny. Something as serious, I should say, something as simple as even being in the pediatrician's office and getting told, oh, you're at the top of the percentile, or at the bottom of the growth curve, can really shape how a child sees themselves and how they eat. So one more resource I want to share with you. Again, I do this just in case you know of anybody who might benefit from this, or maybe yourself, just to learn a little bit more. My friend and dietitian colleague, Amelia Sherry, she's a registered dietitian. She actually specializes in helping specifically moms and daughters create a healthy relationship around these food behaviors. So she checks on your language, the things that you use, and how you model behaviors when you're working with your child. Obviously, she deals with, like I said, women, females, but this really could apply to anybody in the environment who might be using certain language in front of people. So we'll see this come up in the older adults discussion too later in the presentation, but we want to focus also on food safety. Children, as I said before, especially infants, toddlers, their immune system is not fully formed. Oh, you're welcome, Leonie. I'm so glad. Thank you. So we want to make sure that we're not only just, eating and teaching them how to move and these sort of things. We're really trying to be careful with foodborne illnesses. So something called the Fight Back, BAC, bacteria organization put together this little handout that I'll share with you in a different form later on. And also as part of the post event materials, you get some information on this too on a resource list, where you want to make sure that you are washing your hands, surfaces as well, right? Obviously, these little kids are probably not doing the cooking and cleaning. So anyone in the household who has children, make sure that you're not cross-contaminating anything, you're cooking foods to proper temperature. I work with so many people who'll buy juice at like these juice press places saying, oh, this is healthy, or like I got the salad from a salad bar. But really, when it comes to those raw foods that are sitting out open and cut and exposed to the elements, especially in different temperatures or acidic or moist environments, you're really prone to a lot of foodborne illnesses. And we don't want to end up having any kind of issue going on there with different populations who are considered to be immunocompromised. Okay, so next you can nerd out with me a little bit here. Another resource I'm putting in the chat. This is who the big guns are across the country telling us what to do, what to eat, how to live our lives. This is where it comes from. Every 5 to 10 years, we have what's called the Dietary Guidelines for Americans. I have actually sat in. They are public forums on these meetings. They're super cool to watch. Sometimes I get a little frustrated because I feel like their recommendations are a bit outdated and things don't catch up, or at least, anecdotally in the healthcare field, we're not seeing things that I think sometimes comply with what the dietary guidelines say. So I do have issues with how many grains and serving sizes they want us to eat of those things. I also think I have issues with them pushing dairy all the time. So these are just because I work with certain populations who don't fare well with certain food groups. And I think, again, we need to customize our approach, but this is where these recommendations come from. And that's what they are. They are recommendations, guidelines, not hard, fast rules. You don't have to be taking in a gallon of water every day or walking those 10,000 steps. These are just recommendations. So they are imperfect, but useful. And they are, for you to use and customize, whether you are on this side of the healthcare setting or the other side as a patient provider. In that chat, this resource, I believe, is available in English, Spanish. They also have a lot of like toolkits and little handouts that you can use. They also have monthly themes and topics that they use throughout the year as well. And then going a little bit deeper into that is what's known as the My Plate guide. So this might be something that you've seen in the adult version, but you can see how it looks like a graphic that is similar to what a plate would look like. And so you have the food groups broken up, not a lot of distinction of what they are, but on the bottom, I think they give a good definition of what a serving might be or how you might find certain food groups to create a meal plan for yourself. So again, imperfect for me, but useful. I don't think you have to have dairy at every single meal, but I understand that that's a good form of calcium, and calcium is good for growing bones and healthy, strong teeth and that sort of thing. It doesn't necessarily take into account vegetarian or vegan diets. And I do want to let everybody know that, yes, there are definitely ways that you can still have progression and normal growth and development if your children or if your family are following a vegetarian or vegan diet, whether it's your own personal preference or for religious reasons. The only issue there is that you might end up being somewhat deficient in some of the more animal-based micronutrients. So things that are more better absorbed in your body, like calcium, zinc, iron, vitamin B12, and vitamin D. Almost all of these can also be found in plant foods or in supplemental form. And vitamin D, you can go stand outside for 10 minutes and there's your daily dose of vitamin D. So here too, we have these programs like WIC, Women, Infants, and Children. This provides assistance for both development and growth patterns where you're working with dietitians and also other healthcare providers to make sure that children are meeting their needs throughout their first 5 years. And within the WIC program, again, I'm going to throw this part in the chat. You can see there's other affiliated programs like the Farmers Market Nutrition Program, the Head Start that I mentioned before, and SNAP, the Supplemental Nutrition Assistance Program. In this life cycle, the screenings that you're looking for here can really be a combination of both what you do and what healthcare providers do. So the developmental monitoring, this could be anybody who's taking care of the kids. You're looking for these milestones from birth to 5 years, how your child's growing and changing over time, learning, speaking, interacting, playing, monitoring them in that sense. You can, I don't think I have it on here, but you can also download a little checklist of what to look for. And then of course, if you notice anything's a little wonky or your child is not meeting their milestones, talk with your doctor or nurse or healthcare provider about your concerns. Some children just take a little bit longer to develop, and that's totally fine. And it's really just a matter of the pattern over time. If we see some real discrepancies, to make sure you would be maybe working with a specialist in that case. Developmental screenings, that's going to be your healthcare provider team or early childhood teacher or someone who is trained in that way, where they are also looking for developmental milestones and they have specific points in the child's life at ages 9 months, I think 18, 30 months of age. So they're looking for things like that, developmental issues. Things like autism is usually something that will be screened for at 18 and 24 months of age here too. And then last but not least, this developmental evaluation. So this is usually your child's pediatrician, a child psychologist, a trained professional, where they're going to identify and diagnose any of those developmental delays and conditions. So wherever there's a concern, again, I know with children, everything feels like, oh my gosh, this might be an emergency, but allowing things to kind of pass, checking for patterns before anything feels like it's going to be really extreme and something that might need a specialist to step in. All right, congratulations, we're growing. Again, just to reiterate, it's possible this is going to go a little bit past the 1 hour mark because I am not feeling well and there's a lot of information to cover. So if you do have to leave, that's totally fine. As you know, this is being recorded, so you'll get a link after the fact and some downloadable resources that I'll share with you if you need to bolt. So now we move into childhood and pre-adolescent. So this spans a nice chunk of years here. You have from about 5 to about 12 years of age. This is in terms of schooling. This would be, I think, about kindergarten, first grade to about 6th grade or 7th grade or so. So a wide variety of things happening here. The importance of nutrition during this period, we obviously want to make sure, as I said before, we're keeping mindful of anything like iron deficiency, anemia, undernutrition, or malnutrition of any kind in either extreme, either overeating or undereating, especially with quality and quantity. Dental caries, which also known as cavities, so making sure oral hygiene is being kept up. And also preventing any immediate health problems from progressing and reducing that risk of developing a chronic disease. So keep in mind here, though, that growth velocity at this time of life, it's starting to slow down, right? The school age years, periodic monitoring is important, but and you'll probably still be going to see the doctor, but not like every 2 weeks like you would with an infant. So we have what are called the CDC has the growth charts, which are the recommended tool for monitoring and plotting the growth of a child. It's used to track individuals from the ages of 2 to 20. Believe it or not, the study of pediatrics is literally from 0 to 20 years old, or you might see 21 in some cases too. So you're right into the college years when you're still maybe going to see your pediatrician. So I'm just going to add this to chat as well in case you want to learn a little bit more about what they're looking for, how they distinguish between boys and girls through different periods of life, and how they plot it. So this is a little bit different, but kind of similar to the adult version of where we use our body mass index. Again, an imperfect, but sometimes useful tool on how we're maintaining our development. But in the child's case, because they are growing so many in different ways throughout their childhood, you can't just do height and weight with them and just keep it as is. There's a lot of other things to take into account and compare and contrast them with other children in that same area. So just out of curiosity, I'm going to put this in the chat and you can add that on here, or we can talk about it at the end of our discussion. What factors most influence your eating habits during childhood? As you can see on screen, we have a child with an older person. So maybe you cooked and ate with somebody in your family. Maybe you went shopping with them. Maybe you didn't. Maybe you were denied being involved in any of that, like stay out of the kitchen. Or maybe you struggled with food insecurity. And that also ended up either positively or negatively influencing your future skills and development and eating behaviors. Maybe you were taught how to use utensils at an early age, or you were assigned chores that were related to mealtime. So a lot of these different things come into play as well in this area, because obviously dexterity, you have a lot more motor control, motor skills, and muscle control. So you might be able to do more things in this life cycle that can also help in developing your eating behaviors down the line too. Again, either positively or negatively. So I'm sure, there you go, Stanley, time and day to eat. Okay. That affected it. Yep. Yep. So if you had some sort of schedule, right, we're eating at 6 o'clock when your father comes home and we're all going to sit down and do that, or you're early birds and getting up for breakfast. Exactly. So this next slide here, this, if this makes this image, I should say, tugs at your heartstrings, I think it should, because as we learned earlier, eating disorders and body image issues can start as early as 3 years old. So here's a very sensitive area that we're talking about too, right? This development of stages of what they're going through. Puberty is just moments away from happening. And we also have the onslaught of things like social media, magazines, television, any of these messages that we're seeing out there. I think you can't go anywhere without seeing something that is related to weight loss or fitness or what is considered an ideal size. And so, children obviously are very open to receiving these messages, and they want to try the foods that they see on TV. They want to try the things that look and smell really good, or they want to do whatever their friends are doing. And so it's really important for those of us who are providing care to these children that we are responsive to them, that we allow them some freedom, but we also try to encourage them to understand a little bit more about health and wellness needs, trying to including things like healthy and active lifestyle factors for them, especially since we've been stuck so much at home for so long, and encouraging these things like just promoting variety and balance, trying to stay away from any language that's going to make it feel like you are good or bad or guilty, not putting any personification or vilifying or putting moral substance on food. Food is just food. It's either going to nourish you, or it's going to bring you enjoyment when you have celebrations, or it's going to bring you comfort. But just because you eat something doesn't make you good or bad. So be really mindful of the language that you're using around here. Yeah, thank you, Leonie, for sharing that too. Some of the recommendations, oh boy, I wish this is applying to adults like me too. No screen devices in bedrooms. That's one of the recommendations from the American Pediatrics Association. And also potentially even a development of a family media plan so that you're setting good examples, like no cell phones at the table when we're eating, or limit certain times where we can watch television, try to engage more outdoors, get some sunlight on your face. Also things like including calcium rich and vitamin D rich foods because of the peak bone mass that's happening at this time. So we have dairy products, also calcium fortified foods. So if you're not into dairy, you can get things that are fortified. So there's orange juice and other kinds of products that are available out there with calcium in it, and vitamin D from either exposure to sunlight or fortified foods as well. Of course, taking into account if people like me, I'm lactose intolerant, I cannot drink buckets of milk, but I can do some things like my stomach isn't so sensitive with some items that are either fermented or processed in a different way. So there's like hard cheeses that I can eat without having a stomach issue. And I can definitely eat some things like yogurt because that's also a fermented type of food, but I can't do things like whole milk or cheese. Well, I mean, I can, but I suffer the consequences after. I will not eat ice cream, but I'll be in a lot of pain afterwards. Cold water, or water, I should say, is really the best go-to fluid for children. Obviously, at this time of stage of life, if they are involved in sports and they really are excessively active and sweating, then they might have something like a plain sports drink where they have those electrolytes built in. But we really don't encourage things like soda or juices or sports drink like Gatorade just for the sake of having fluid in a child. So if your child likes some tastes and stuff, you can offer up flavored water, or in what am I trying to say? What's the word? Infuse. You can cut up lemon slices or different, model strawberries at the bottom of a pitcher and add things in there, or do a no salt and no sugar added flavored seltzer. Just kind of jazz things up a little bit because that tastes a little bit bubbly and soda like without the sugar sweetened beverage being added there. Yeah, 60 minutes at least of physical activity each day. I mean, who's even getting this? As a kid, I feel like I did get that. My parents were always telling me, get the heck outside, go play with your friends, run around, play tag. What else did I do? Roller skating. Oh gosh, we were out all hours of the night, and we would actually get bummed out when we'd get called in. But nowadays, I'm not too sure about what the status quo is there. Calls for increasing regular exercise through physical education. So the PE classes that you have in school are really kind of few and far between, and recess. So again, being in New York, I do see kids running around on the blacktop out there. So I hope that they're getting their enjoyment and able to move around and get some physical activity. All right, moving on to adolescence. So now we're coming into that later stages of that pediatric life cycle here of the 11 to 21-year-old. Lots of differences here, right? 11, you're, like I said before, what, fifth or sixth grade? 21, you're almost done with college. So there's quite a large amount of physical, emotional, cognitive changes that are going on in this section as you're developing into adulthood. You also start having these physical and psychosocial maturity factors that are accomplished as well. And I'll share with you too here this graph or chart where you can kind of see the onset of puberty that ranges for females from about, I think the average age is about 12. So anywhere between 8 years old, young, right, to 17 years old could be the onset of your first period. Males end up showing a great deal of variation as well in this chronological age where sexual maturation takes place. So you're starting to see the growth spurts happening here. You're starting to see facial hair come in. You're starting to see, curves and bumps and things filling in, which continues up until about age 21. And we also want to recognize here too, which is another reason why I'm conscientious when it comes to body fat discussions, is that you do need a minimum of about 17 to 20% of body fat, even for your hormones to function normally. So granted, there are definitely some people who are just smaller built or, very frail looking, even though they're healthy in all other ways. But if your body is denied that fat, it doesn't have the ability to insulate, protect your organs. It doesn't have the ability to help you with producing hormones. And it is needed to maintain not just that first period for females, but also maintaining normal menstrual cycles throughout the life cycle. And as we'll see later in life as well, to even help sustaining a healthy pregnancy. We've seen, I think, somewhere around 25% or so body fat is usually like the sweet spot there. Anything under that or over that can offer different extremes as far as hormone production and reproductive support. So just things to keep in mind. And oh gosh, this is where the fun fact starts happening. About half of bone mass is accrued during adolescence, and this is where your peak muscle mass is happening. So yeah, kids, we're coming upon a time where it's going to end up being all on us to maintain, because your body's going to start slowing down at a point where it's not making this stuff for you anymore. It's up to us to have to build on that. So going on to also some concerns around this stage of life, busy lives, right? They're independent. I mean, 11 years old, maybe not, but 18, you're going out for getting your job when maybe you're 15 or 16, you're driving, you have independence, busy lives. Maybe you're involved in extracurricular activities or different social settings. So now maybe you're just doing snacking instead of actually sitting down and having a meal, or you're skipping meals because I got to study for an exam and I don't have time to be sitting here and having breakfast, or you're eating away more often from home, fewer family dynamics happening here, or now maybe you're following your own patterns as you start learning and wanting to experiment more. Maybe now you're following a vegetarian or a vegan diet or a keto diet because that's what your friends are doing, or you're really into sports and everybody's, carbo loading for certain things or being protein packed because they're into bodybuilding. So this also takes into account different levels of physical activity and individual needs, but it's a time to just keep an eye on what might be throwing people off of their nutritional support. And so here we have a few things that I wanted to point out. So iron rich foods, which are available in a lot of different ways. So we have animal-based iron foods like salmon and meat and sardines and that sort of thing, but we also have plant-based foods as well, like leafy greens. However, if you are going to go for plant-based iron-rich foods, I would also encourage you to add in some vitamin C. So squeeze a little lemon, throw in some chopped bell peppers, or have a little side dish of some strawberries while you're eating your salads, because that really helps extract that iron that is bound inside the plant to come out and travel through your body. So iron is obviously needed for things like your blood system, and for females, helpful during periods as well to make sure that there's no iron deficiency and anemia going on there. Vitamin D is also an essential micronutrient in facilitating the intestinal absorption. So it's used in what our body needs to absorb calcium and phosphorus in order for our bones to form and be strong. So again, you can go stand in the sun for about 10 minutes if you want to, or you can also take salmon, swordfish. There's also fortified foods like vitamin D, fortified orange juice, and other kinds of plant type foods that are fortified with vitamin D as well. So you usually see that in more animal-based products. And then last but not least, one of the other micronutrients of concern is folate, or you might also see this as folic acid. This is very important for anyone in childbearing years. So you'll find this in foods like dark leafy green vegetables, beans. This is actually a lot of plant-based foods. And we also, because of the nature of our country, we fortify packaged foods like flour, breads, pasta, cereals, just because we don't want anybody to be folate deficient, because that can lead to what are known as neural tube defects. So things like spina bifida and other issues during infancy, because obviously a lot of people don't know when they're pregnant. And so we have a very finite amount of time in the first stages of life in the development of the fetus, that if you are folic deficient, it can really mess up your baby's development in utero, and you won't know that until it's too late. So that's why we have fortification of a lot of our foods here in the country. And so recommendations, nothing different than you've probably already seen, right? Keeping the home environment as accessible as possible if you have the ability to do that. Try to stock a variety of different foods in the house, because especially teenagers, they're going to be running in, running out, grabbing things based on availability and convenience. And as I said before too, it's possible that, as school ages start getting older and older and they're in different systems, whether they're in public school, private school, college, you're starting to see less and less physical education or PE classes being held. So trying to get them out there and get to be as active as possible. And knowledge alone is not really going to make or break us, but making sure we also watch our behaviors, be conscientious of when you might see behaviors changing, and acquiring those skills that are needed to shop and prep on our own as we age, being able to have access to certain foods, ask the right questions, reach out to community programs that are essential in helping meeting our youth's growth. So here are some of the screenings in this particular stage of life where you have immunizations like chickenpox, measles, rubella, hepatitis A and B, etc. So you'll see these being offered to you probably at your wellness visits at this age. We also have screening tests and examinations when lab works are done that we're going to see if any diseases are starting to appear. And so we have things that we do like blood pressure monitoring, vision and hearing, high cholesterol, yes, and this no matter where in your life cycle, but right around here too, because we also see people maybe venturing outside of the normal quote unquote healthy foods and they're eating outside foods, packaged, highly processed foods that could potentially lend to things like high blood pressure, high cholesterol, high blood sugar issues. And then last but not least, very important, I think, not just well, you see it here as counseling services, but we're talking about things like counseling on things that could be prevented, like skin cancer, tobacco cessation and substance use or misuse, sexually transmitted diseases and infections. So that's also helpful. People get, this is when you're in health class, right? And you're like, oh gosh, the lady's coming to talk to us about all these awkward, uncomfortable things. That's what they're purposely trying to do. They're probably trying to spread the word. Okay, again, just to remind everybody, we are on the last couple of life cycle stages here. So we're coming up on the last part of the hour. So if you do have to leave, I know for a fact I'm going to be running at least another 15 minutes late. So if you need to peace out, you can, and then I'll send you the recording link within the next couple of days or so. So let's enter into adulthood. And this I love this graphic because this is not, when you talk about the decades of life, this is not related to that. This is related to when you were born, like when your actual date of birth was, of what these generations are called. So you can be Gen Z or a centennial, you can be a millennial, you can be, I'm a Gen Xer, there could be baby boomers. So when you hear these terms coming around, it's not just because you're 50, it's because you were born in a certain era, a certain year that is where they place that label on you. And so when it comes to what this is going to be, this early adulthood, so now that we're picking up where we left off with the pediatric discussion. So now you're 20, 21 and moving forward, you're entering into the midlife area of being in your 40s. You have some things that might now be modifiable realistically. What are modifiable factors that can influence anything when it comes to health and wellness? Those are things like, stopping smoking or moving around a little bit more, adding some healthier foods to your diet. Can't stop being older. That's not a modifiable factor, unfortunately, but there's definitely a lot of other things that we can take into account and be accountable for. But as I said in the beginning of this discussion, that feels like an easy way to just be like, you should be in charge of your life. Well, if you have access to things, if you are not marginalized, if you are able to even, share and have the support that you need, especially if there's a mental health or behavioral component to things, that's not really just always on you as a person. So I do want to acknowledge that the system plays a role here as well with supporting your overall health and wellness. Okay, moving on to what we call the sandwich generation. So you're kind of sandwiched in the middle of caregiving for your children and caregiving for your elderly or your older adult parents. At that point, that might be something that you're doing as well. So we have this multi-generational thing going on, whether in your household or in multiple households. You're juggling the role while you're maintaining a career, while you're trying to take care of yourself. So now all of a sudden your health is potentially at risk because you're not doing what you want to be doing to prioritize your health. And as we get later on in adulthood in 60 years and above, now we start transitioning into hopefully retirement. We might have more leisure time. Now we can start paying attention to some things. And, it's true what they say, that it is really never too late to start some things, but there are definitely some issues and consequences that could play a role that you might not be able to reverse, but hopefully you can prolong them or from progressing into worst case scenarios, even if you do end up not paying attention to something until you're in your later adulthood. So just as far as development grows, this is what I was kind of getting at before, which I think is funny / not funny, where your bone density continues until about age 30 and your muscular strength peaks around that same time too. So now it becomes a flipping full-time job just to kind of keep everything from falling apart, strengthening ourselves, making sure we're eating the right amount of food, making sure we're getting enough protein in our diet, making sure we're doing, which I'll share shortly, physical activity that helps us with building and strengthening our muscles to protect ourselves and not suffering the consequences of things like falls and fractures later on in life. You also want to make sure you're paying attention to other things too, because hearing loss does begin earlier, around like 25 years old. And of course, if we are like in the city, there's a lot of noises going on here. It might affect us even earlier than that. And if you're like me, my vision started changing when I was about 11 years old. But usually if you have not had to have any glasses or prescription lenses for your vision, around the age of 40 or so is usually when we start seeing that happen too. So, try to make sure you're going to get screening for things, go to your eye exams, and make sure that you're paying attention to as much as you possibly can in anticipation of whatever is going to happen in the following decades to come. Some of the challenges here, not our fault. We just, by nature, there's some decline happening, right? We have altered metabolism. There's structural changes and breakdown in our tissues. Things can become, as I said, permanent and irreversible. Some of these examples are things like coronary artery disease, kidney functions, blindness. These are things that might not be reversible. So managing the condition is really the primary focus there, and preventing further complications. So preventing things from happening that makes it worse, optimizing whatever you can with your quality of life, and making some adjustments as you can within whatever you can do there. Screening, again, comes into play here with identifying any changes from stage to stage, especially if you have been diagnosed with something like high blood pressure or chronic kidney disease, and then taking into account things that you can do for yourself. So not every doctor, this is something I champion all the time for, and they shouldn't, not every doctor knows what they're talking about when it comes to nutrition. They don't take enough classes for it, and they're not specialized in that. And that's okay, because they're doctors. They're supposed to be generalists, and they're not supposed to fine tune on what I, as a dietitian, or my peers are supposed to do when we're specializing in things. So I do want you to ask questions. I do want you to find out, not just say, oh, do I need to see a dietitian? Instead, ask, please write me a referral to see a dietitian. Please, if I have been diagnosed with prediabetes or type 2 diabetes, please write me a referral to see an endocrinologist, because the doctor is not going to be able to specialize in that, even though they might want to take charge of that session and bill you for it or bill health insurance. I really think it behooves you to have a team of experts on your side to help support you if you are dealing with those types of issues there. Again, it can be, it can be challenging. I mean, change in itself is difficult. It's hard to be like, oh gosh, I'm falling apart, or things are getting worse, or I wish I would have paid attention in my earlier years. But just stop where you are and see what kind of changes you can make going forward. Next up here, some of the recommendations, as I said before, came from that Dietary Guidelines for Americans. And now we have something called Healthy People. Was 2020, now it's 2030. So these are the overarching goals and mission-driven approaches for the entire country for the next 10 years. So from 2020 to 2030, we're trying to address multiple areas where we have factors to help with adult improvement. So we are trying to address, systemic issues or health inequities, access to better quality foods. But, depending on where you live, depending on what your community is, I don't know if we've made it there yet. I don't know if we can all honestly say that we've covered it, that we fixed whatever's broken in the system. Elizabeth, I see you're unmuted. Did you want to chime in? Oh, that's okay. That's okay. No worries. No worries. Right. So when it comes to health disparities or healthcare disparities, we're talking to differences between groups when it comes to insurance coverage, access and use of care, quality of care. I, as a healthcare provider, I'm trying to take insurance. It is killing me slowly trying to figure out how to do this, because they want so much time and energy spent on pre-approvals, so much time and energy spent on submitting claims. Then I have denials. Then I'm told the diagnosis code is wrong. I, as a dietitian, cannot diagnose my patient. So I have to go back to the doctor. And the patient says, but I don't need a referral. And I say, I know, but I still have to get the diagnosis code from your doctor. And then I'm told certain companies won't do preventative care, and other health insurance companies will only cover certain things that are related to kidney issues or diabetes. And maybe I don't have clients right now that have those things. They want to prevent stuff. So now they have to pay me out of pocket. And it's just really unfortunate that there's so many different issues that come up that really prevent people from taking that role. And so, not that I encourage anybody ever feeling like you have to devalue what you're worth, but if you are in the healthcare setting like myself, I know what I want to charge people. Like, I know what I want people to pay me, but I also know that the group of people that I'm trying to reach out to can't afford the number that I have attached to my sessions. So I want to offer them, and I am offering them as best as I can, discounts to things, different tiered types of programs and sessions that might be a little bit more affordable to them. I also always try to put out some pro bono sessions to people who just can't pay anything at all. And I try to do my best with making money in other areas of my life so that I can try to support my community in the better way that makes it accessible and affordable to them. Some recommendation. Oh, you're welcome. Oh, thanks, Stanley. He had a piece out. So other things here, as you see here, dietary guidance, again, stuff that you've probably heard of before, increasing the colorful things. I always try to say to people, don't worry too much about what to get rid of on your plate, but what's missing. What can you add to your plate? Because as you make room to add stuff, the other stuff might kind of scooch over, and you might be eating less of the things that aren't so maybe helpful for you and eating more of the things that are more nutritious and health supportive. Trying to keep sugar and sodium intake low. Sugar, as far as refined sugars, those added sugars, again, you want a banana, have a banana. You want to have a chocolate chip cookie, have a chocolate chip cookie. But, be careful with how much you're consuming over the course of the day. So try not to have an entire shake of just bananas and pineapples and mangoes every morning, because that can be a real shock to the system, even though it's fruit. Try to be conscientious of how much is too much in anything. I ended up getting a kidney stone. I tell this story all the time from having too much spinach, because spinach contains what are called oxalates, a very high percentage of that, and they end up kind of interacting with your chemical structures in your body. And I end up getting a kidney stone from having too much spinach. So this is what is known as when fruits and vegetables attack you. So, portion sizes, moderation, flexibility in your foods. Try to have a lot of fluids throughout the day as well. Water intake recommendations are about 2 to 3 liters, depending on who you are. So, just like what you're told, 6 to 8 cups of water a day. Try to make sure you're choosing water as your preferred beverage. If you hate drinking straight water, as I said before, you can find different flavored type of things, infuse your fluids, do teas, anything else that's just going to keep you super hydrated. Speaking of hydration, though, be conscientious with caffeine and alcohol intake, because that can really mess up with some stuff. Caffeine, not terrible unless you're in what's called toxic high doses. So right now, what we say is about a cup of coffee contains, so we're talking like just a normal 6 to 8 cup of ounce cup of coffee contains about 95 milligrams of caffeine. And we're trying to encourage people to max out at about 400 milligrams of caffeine. So that's 4 cups a day, which is pretty liberal. Anything higher than that could potentially have some adverse effects. There have been huge studies. I cannot say this enough when it comes to alcohol. If you've not started drinking, just please don't. There has been a little, well, again, if anybody wants to nerd out with me, I'm going to copy paste this into the chat too. The Lancet study that was done globally, where they have found no level of alcohol improves health and actually may end up being a risk factor. So even though you see things like the Mediterranean diet, which includes a glass of wine, or even in our dietary guidelines, which shows you how much is considered a drink a day in a moderate level, I really would encourage you just don't, because it has been shown to increase cancer risks and other potential issues. So I know, sad but true. Your margarita night might end up ending at some point. So here too, in the adult section, this is also a way that we can kind of breathe new life into what we have to unlearn, the things that were not so positive in our early childhood years. We might want to get back to basics, start developing that innate ability to understand what we want to eat, when we want to eat, the attitudes that we have around food, how we accept ourselves and the foods that we are eating within a particular context, getting back to learning to like a variety of foods, trying to put boundaries on things like other people's problems and work and all of these other overarching factors in our lives that take place, instead of prioritizing our health and setting aside time and discipline and boundaries to prepare our own meals, or try to make some sort of structure happen again so we can get back to basics and really support ourselves in that way. I'm leaving this up because I think this contains a lot of information. I don't usually like a lot of words on PowerPoint slides like this, but I just thought this was great at a glance, that you can see basic recommendations for physical activity. I mean, I'm just not a natural exerciser to begin with. I had to kind of force myself to do it, but I'm very anxious. And like right now, I have a full day, and by the time I'm done with all of you, I have another thing to do at 3 o'clock, and I won't really be having time for myself until 4. But the first thing I'm doing is taking a walk outside. I just need to stretch my legs. So I might not be getting in my 30 minutes of moderate intensity physical activity, but I definitely want to move around. And I definitely include things like strength training because, as I said before, your muscles and your bones kind of quit on you at a certain point in your life. And then it becomes on you to make sure that you're maintaining that strength and that integrity, because that really does help with protecting your bones, providing you, or I should say, preventing you from things like osteoporosis later in life, bone fractures, etc. Okay, just a couple more things here and then we'll go into older adults and then I'll wrap up. So I appreciate for those of you who are still on with me. Thanks for hanging in. If you do need to leave, that's okay. The recording will still continue. But these are some of the nutrition assistance programs for adults. Again, I'll put in the chat. This is, I think I copy pasted this before with the SNAPs. So that's Supplemental Nutrition Assistance Program. Within that, you can see Meals on Wheels. I'll put this in the chat as well. Every city is a little bit different as to what they do, but these are usually nationally funded programs. And then depending on, where you are, what community you're in, I believe that they just extend the health, food safety, they extend food banks, they provide soup kitchens and shelters and so on. And putting all of this together, coming back to where we started off with that access, right? Having access to a variety of healthful foods, understanding their food choices, the positive attitudes around eating, how they feel about balancing their diet with what we're going to call discipline. I don't like saying willpower, but just like having that routine and structure, trying to let go of any of those negative connotations that you have about, if I eat this, I'm a bad person. No, just get back on track, try to do the best you can with variety, moderation, and balance. And some of the screenings here, just to remind you that if you haven't started making your, because we're going to be coming up on the new year in a handful of months. If you haven't started making those appointments with your doctors, please make sure, especially if you have a family history of things like polyps or colon cancer, make sure. I just went to my first colonoscopy ever on Friday. It was the best nap I ever took in my life, and it was totally fine. Even the preparation for it wasn't as bad as I thought it was going to be. It only happens once in a while. For me, I was clean. I don't have to go back for 10 years. Other people who might have issues might have to go back every 1 to 5 years. But the prevention that you take now can help with eliminating any issues down the line. So please make sure that you're attending all of your regular exams. All right, my friends, last but not least, I'm going to introduce you into the older stages of life as an older adult. We're no longer using the term elderly because we have decided that when we know better, we do better. And the term elderly tends to sound a little bit ageist, which means that it's a form of prejudice that when you hear the word elderly, you think sick, frail, dependent on others, and and then unfortunately you end up having less robust care. You might have negative outcomes that are attached to being frail and sick, but what we want to do instead is change the scope of that and just say older adults. And so let's define that term. You can see a wide variety of organizations define older Americans starting at different points of life. This is when you are eligible for things or when research is based on. So you could either be 60, 65, or 70 and be considered an older adult. So that's usually depending on the organization here that you see in front of you of what they would term that. And the US Census Bureau in particular actually divides older adults into more categories, something called a young old, an aged, and an oldest old. I mean, this is, I don't know, that hurts my head. So anywhere between the ages of 60 and 70, you're in the older adult category. Let's talk a little bit about longevity, because this, as we get older, like we said before with the ages discussion, it doesn't mean you're going to be sick and frail and broken in pieces. Like, it just depends on what you're doing now and how that might define your quality of life later on. And we come to see that as far as the CDC, the Centers for Disease Control and Prevention are concerned, that we have about 51% of the factors involved in how old we can be, how long we can live, are really dependent on the lifestyle factors. So again, not just the choices that we make, but what is accessible and available to us. So think about some of the risk factors that you might be dealing with right now. We're talking about things that are modifiable realistically. Can you change anything about your sleep habits? Can you change anything about your eating habits? Are you stressed out over things? Are you not getting the proper self-care? Is there anything that physical wise, like, are you not taking care of your body, your symptoms, your signs? I know I'm in the middle of this right now. I got a very busy couple of weeks and I can't do things, but I know I have to. So I'm trying to find ways to prioritize that stuff. So I encourage you to think about that too, because as you can see here, aside from COVID stepping in and kind of throwing this a little bit out of whack, our US life expectancy as of 2019 is about 79 years old. So we are aging, we're staying older a lot longer than we used to. Globally, in comparison, global life expectancy is on average about 73 years of age. So this is something funky that I wanted to share with you too on that note, because when it comes to the aging theories of how to explain these changes that happen as we progress in our later years of life, we have a variety of different things that can take place. We have things like a predetermined expiration date where cell replication only happens at a certain time and then everything starts expiring. We have something that you see on screen that's related to what I'm about to talk about, where we have what's called the molecular clock theory, meaning that the telomeres, so these little tiny, you might actually see things like this on some health programs if you watch anything like I do, or on documentaries. So these little telomeres at the ends of our chromosomes, they shorten over the course of our lives. And the thing that supports that is what's known as methylation. So just to branch off for a second, methyl groups are a carbon hydrogen molecule, CH3. That's a methyl group. And you find these things, it's just a fancy way of saying plants. You find methyl groups in your plant foods. This is why we're encouraging you to eat your fruits and vegetables, because these colorful plant foods really help with hopefully lengthening those telomeres and allowing you to live a more long, healthy, quality life. We also have theories like wear and tear theories, cytotoxicity, meaning that your cells are dying because you're under stress, whether that's oxidative stress from having too many sunburns or skin cancer or smoking, or because you have live fast, die young kind of philosophy, where that fast pace of whatever it is that you're doing is actually taking years off of your life. So think about some of those theories, how they might apply to you. And is there anything that you can conscientiously, realistically do to help modify that? Body composition that changes over life here again, right? Okay, so I'm rolling my eyes because we all know there's going to be some things hurting and things that are changing and shifting, even if we are trying to take responsibility over what we're doing with our physical activity. It's just going to be a constant state of decline in some of the cases here, where we lose water in our bodies, we become less water full, so we become a little bit crepey, the tissue starts kind of thinning out and becoming a little bit drier. We do lose some of what's called the lean body mass and fat, so you do see the older people do sometimes seem a little bit frailer or thinner, or you can kind of see skin and bones depending on what kind of frame they are, or what kind of actions they've been taking up until then. Gradual increase in some body fat, so now you're starting to see fat in different places that you maybe never had before. So these are all age related issues that are going on, and that even though I put in quotations when it comes to muscles, this use it or lose it, again, I just want to be conscientious of the wording of things that we see in some of the guidelines, that I would prefer just to say move what you can when you can, right? Just try not to stay sedentary. Even if you are confined to a wheelchair, or you're recovering from an illness, injury, surgery, whatever it is that's going on, you're probably still hopefully being told by your doctors and specialists to follow some sort of physical therapy so that your body is not becoming stagnant, whether that's somebody helping you jiggle your legs to get the circulation going, whether that's you having to do certain movements over and over again to get the blood flowing in different areas of your body, or to strengthen things that have been pulled muscle wise, tears, etc. Just move what you can when you can. Try not to be too sedentary in your life. And then we also have other things like taste and smell issues that decline. Issues with teeth and oral disease or oral health can be an issue here too. Saliva becomes a little bit more viscous with age, and it does end up unfortunately slowing down nutrient absorption. We might also have gastrointestinal issues, and a lot of these things really end up causing us to be malnourished, not just because we might have issues with tasting and smelling food, but if you don't taste and smell food, what's the enjoyment in that? So if you're no longer enjoying the act of eating, that can also mess with your mental health, and you see a lot of depression and isolation happening in older adults too. And again, some of these risk factors when it comes to access and health inequities, here on this slide, a lot of different things that can play a role too, whether it's hunger, poverty, functional disability, isolation, depending on where you live and how far away you are from things, developing those mental health disorders as we age, as I said before, dentition or oral health decline, polypharmacy, right? When you're older, you're popping a ton of pills sometimes, and that can really mess with so many things, with nutrient absorption, gastrointestinal issues, and just the mere fact of having to maintain that all the time, that it feels like I'm eating more pills than I am food. So a lot of things to take into place here. Other things of concern, same as before, iron and calcium play a role, because again, trying to maintain the bone and blood function as we're aging. So I shared a little bit about that before, so I won't go too much into it now for the sake of time. And then here too, with physical activity guidelines, keep on keeping on, move around, try to make sure you're taking in enough food, protein foods, whether they're plant-based or animal-based. This really does help with staving off that age-related muscle loss, and it also helps with healing if you are dealing with surgeries, fractures, wounds, especially as we're aging. Sometimes we do end up with, different kinds of cuts and bruises and falls and so on. So these are things that are going to help you with that too. Coming back to where we started as well, right? We started with infants and immunocompromised population, same thing with the elderly. Now you're starting to lose a little bit of that immune system happening there. Certain conditions that may also place you in immunocompromised category could be things like living with HIV, anything that's destroying those immune cells and leaving yourself vulnerable to these other attacks on your body. So autoimmune diseases as well. Cancer treatments could cause you to have a suppressed or compromised immune system, infections that can weaken your body if you have a bone marrow transplant, because we need white blood cells in our body to be able to function with the immune response, and underlying conditions that end up happening as a result of that. So here too, right, we're not just talking about food and physical activity. Wash your hands, make sure you're not cross-contaminating your cutting boards, make sure you're keeping things refrigerated properly. So if you yourself are in this age bracket, or if you're taking care of someone who is, or if you have an older adult parent who has maybe like a visiting house person, these are things that I'm hoping that you're communicating with them, making sure that they're putting their food away after they eat, making sure that they're cooking food to a certain temperature so that they don't also put themselves at risk for these foodborne illnesses. And then here we have the governmental programs for older adults, a little bit more elaborate, and I'll make sure that this is part of the resources that I'm sending out after the fact. So we have things that are specific to just the general population and the older population. We also have things specific to like the Ryan White comprehensive AIDS resources established specifically for anyone living with HIV. And then we have some other things too that are related to different chronic conditions, issues like home delivery, grocery programs, etc. So making sure you know what you have access to. Screenings, you still want to keep going to the doctor as you're aging, making sure you're keeping things in check. We also have now this nutritional and malnourishment screening going on to make sure that you're not wasting away unnecessarily at the end of your life, blood pressure and screening for cancers, etc. So making sure you're keeping all of that focused too. All right, my friends, you have hung in there. Thank you so much. I know that those of you who are on here physically right now are less than 35 people that signed up, but I do hope that this was interesting and informative. If there's anything you'd like to put in the chat, please feel free to do so. I'm just going to share with you a few more things before I officially wrap up about developing SMART goals for yourself. So looking at those things that are achievable and specific to what you might want to accomplish, whether it's setting aside 30 minutes a day to practice gratitude, whether it's scheduling in those doctor's appointments, whether it's, adding maybe one more fruit or vegetable into your diet over the course of the next couple of weeks. And you'll also get the recording, some downloadable resources, a survey. If you are a Lehman College student, as I mentioned, we'll have some information for you specifically as well that will come out from this too. So keep an eye out for some of the Dish with Dina webinars. And we also have some of the Lehman College CUNY Cares team. My interns here, Michael and Masase, will also be putting together some webinars there too. So I'll make sure anybody is invited to this. For these webinars, you don't have to be a Lehman College student. You could be whoever, anywhere. Please continue, if you want, stay in touch with me. I have a variety of things I'm going to throw into the chat box right now as far as my social media contacts are considered. So I think you can click on that. You can always reach out to me. If you are a Lehman College student, you can hover over this slide right now. You can sign up for our email list where we will provide to you updates on the programs and the services we're providing over the course of the fall semester, like coordinating an appointment with you for the SNAP coordinator that's coming to visit in the next couple of weeks, and also facilitating things like the counseling center. Like I said, I'm going back to do nutrition counseling this semester. That's actually me on my flyer that you might see on campus. If you're not a Lehman College student, I'm putting in the chat, you can set up one of those nutrition counseling sessions with me in my private practice. As I mentioned, if we are a good fit for each other and you can't afford my regular price, I do offer things like discounts and pro bono sessions for anyone who is dealing with financial hardships. And I'm also trying to put together a variety of other things that aren't necessarily webinar or counseling session related. So keep an eye out for some of these other things that I'm putting together, like these online courses. Any questions, comments, or feedback in the hour and 28 minutes that you spent with me that I didn't cover that I can address here, please feel free to put that in the chat. And let me just scroll through here. Thank you so much. I appreciate that this was informative. I really appreciate that. That makes me feel good. Leonie, the Lehman student sessions, as far as nutrition counseling is concerned, so if you go back here, like this one, I'm going to try to do both. I'm going to be in the Student Health Center 2 days a week on Wednesday afternoons. Technically, I'm supposed to be there today. So Wednesday afternoons and Thursday mornings from 10 to 2. Those are in the Student Health Center, but I also have the ability I have a HIPAA compliant private portal through Zoom. So I can meet via telehealth for anybody who doesn't want to come, or like on a case like today, I can't physically be there, so I can meet with my student patients via virtually. So that could be done either one. The other things like the webinars and things like that, those are a variety of both. Like sometimes the SNAP coordinator will come in person, so that you might have to be on campus to fill out forms. But some other things that we're doing, like nutrition education and wellness webinars, virtual workshops, those will all be virtual. So yeah, so just keep an eye out for a lot of the things that we have going. And I'm excited to also gain feedback. So if there's anything that is not listed on there that you're interested in learning more of, please share with me in the post-event email and the survey link that I send out so that you can provide me with some feedback. Thank you so much. Thanks for coming. I really appreciate being here with everybody, and I hope to see you again in our next event or our next webinar. Thanks, everybody. Have a great day. Thank you. Bye.
Thank you. Bye.
Bye.